So we'll be looking at another essential test that we can use to actually assess for tubular integrity. And what does tubular integrity mean? Tubular integrity means you are trying to actually check out for the renal tubules, that's proximal convoluted tubule, distal convoluted tubules. You are trying to check out if they are functioning optimally. Okay, so we'll be looking at how we can be able to use the plasma beta-2 microglobulin as a method of accessing tubular integrity. Okay, so this plasma beta-2 microglobulin, let me just tell you guys a little story about it. It's basically like a protein, okay, that is what greatly reabsorbed by the tubules. Do you understand? So now, if you want to test for tubular integrity, you give the person this protein. You know that this protein is greatly reabsorbed. Now, if you come and see a great amount of this protein in urine after, then there is a problem. Okay, so that's how we can use plasma beta-2 microglobulin to actually access for tubular integrity. Okay, so let's read what we have in the lecture. This beta-2 microglobulin is a small peptide. Okay, it's a small peptide. The molecular weight just 11.8 kDa. Okay, so it is present on the surface of most cells and in low concentration in the plasma. Okay, because it's in low concentration in the plasma. All right. So this type of protein is what completely filtered by the glomeruli and is reabsorbed and catabolized by what proximal tubular cells. That's a proximal convoluted tubule. Okay, so looking at this now, this type of protein should go all into the glomeruli and should be reabsorbed in the proximal convoluted tubule. All right. So now the plasma concentration of beta microglobulin is a good index of what glomerular filtration rate in normal people. Do you understand? And is being unaffected by diet or muscle mass. Okay. So now plasma beta-2 microglobulin is increased in certain malignancies and inflammatory diseases. All right. So now, the main point now, since this plasma beta-2 microglobulin is what normally totally reabsorbed and catabolized in the tubules, measurement of beta-2 microglobulin excretion provides a sensitive method of accessing tubular integrity. Okay, so this protein is meant to be reabsorbed in the proximal convoluted tubule. If you find this protein in urine, excreted in urine in excessive amount, then definitely you know that there's a problem with the renal tubules. Okay, so guys, that's it, and that's how we can be able to use plasma beta-2 microglobulin, okay, to access for what tubular integrity. Okay, so that's it, and bye for now.